Hello everyone, we're continuing our talk series about nutrition, especially nutrition for diabetes or anybody who wants to lose weight, control their blood sugar, or help with any of the metabolic issues such as metabolic resistance, insulin resistance, metabolic syndrome, and so on. So here we're coming today to an important point, which is about fruit, dessert, snacks, and some of the deadly traps that we frequently fall into. So stay tuned and let's begin right now. You remember what I told you about sugar. The first thing I said about cutting sugar from your diet being one of the most important things that you should do for diabetes. Now, sugar comes in solid form, like a dessert, like a cookie or hard candy or a muffin or so forth, but also, or ice cream, but it comes in liquid forms as well, such as the sweetened drinks. You need to cut out those two forms as much as humanly possible, because those don't add any nutritional values. They are empty sugars, empty calories that raise your blood sugar and also keep you hooked to the sweet taste of dessert and sugar in a way that it becomes sometimes hard to break free from that. We'll talk about the two aspects of it, whether it is in the drink or in the solid food, but I just wanted to give you kind of a bird's eye view of the whole topic first. But what can you have as a dessert or something sweet after the meal? Well, fruit is an excellent dessert. Now we have a saying that I want you to remember, which is fruit is an excellent dessert or is the best dessert, but it's the worst snack. And why is that? I will show you in a few slides. But I want to talk more about fruit. It's a fascinating topic, and obviously we can't go 100% with every single detail here because it would take us hours to just talk about fruit. But I want you to remember that not all fruit are created equal. Some fruit and some ways of preparing fruit are much better than the others. Okay, so I'm starting here from the absolute worst kind of fruit, and we're going to go to the better and then the best. The worst kinds of fruit are the juices. There is nothing worse as a form of drinking fruit or of having fruit than drinking a fruit juice. And the reason is because fruit juices, they always add a lot of sugar, and it has a very high sugar content. So there is a particular problem that happens when you consume sugar in a drink form that is even worse than consuming sugar in a solid form, which is what we call a glycemic index, that it raises the glycemic index very high, and also the glycemic load. Now, what is the glycemic index and the glycemic load? Glycemic index, basically, it's how quickly does the sugar present in any food or drink item hit your bloodstream. So an item with a high glycemic index, for example, like the fruit juice, it hits your bloodstream very fast, to the point that we use, or some people use, fruit juice, especially orange juice, to treat a low blood sugar. Why do they use it in that context? Because it raises the blood sugar very fast. Now, if you have low blood sugar, maybe you choose to drink orange juice to restore it, although I'll tell you there are multiple better options. We'll talk about it in future videos when we talk about hypoglycemia and its management. But it's not a bad way, and it's definitely a very quick way of treating hypoglycemia or low blood sugar. However, it is not a good part of your diet in general because it's just so sweet, filled with sugar, and it actually raises the blood sugar very quickly and makes you crave more sugar and more carbohydrates down the line. Fruit juice, try to avoid it as much as humanly possible. Eliminate it from your diet, please. And a phrase that I want you also to remember and stay in your mind is eat your fruit, don't drink your fruit. So how about just eating a fruit rather than drinking it? Because also when you make a juice out of fruit, there is more to it than simply adding sugar to it. You also are losing a lot of the fiber that's present in the fruit and a lot of the water content of the fruit, and those are things that help help the sugar in the fruit become less intense and less concentrated and regulate the blood sugar much better. So it's much better from that perspective to eat a fresh fruit than it is to drink a fruit juice. Now, the second thing that is not considered to be a good way to eat fruit is under the picture of the juice on the left side, you will see preserved fruit. And preserved fruit is really not good because it is preserved in syrup. When you hear syrup, whether it be a preservative for fruit, or whether it is even in a mixture like a cough mixture that is called syrup. Syrup means sugar. Syrup means that it has sugar in it. So it's going to raise the sugar content of that meal significantly, and you don't really need that. It's not a good thing. It's going to raise your blood sugar and cause your diabetes to go out of control. You don't want that. Now, some people may say, well, okay, but how about if I get preserved fruit in water? It still has more sugar than fresh fruit. And why would you do that anyway? You have the better option of eating the fresh fruit that preserves its nutrients, its vitamins, its minerals, and it gives you more fiber and less of an intense in sugar spike, less glycemic index, more water. So from all aspects, eating a fresh fruit is just way better than having a preserved fruit. So avoid the preserved fruit as much as you can. The third item of a bad example of fruit preparation is on the right side, where you see dried cranberries and dried grapes, is basically raisins. And a lot of people unfortunately think that these are good snacks. They are bad snacks. They are really, really bad because they raise your blood sugar very quickly and very high. They have very high sugar content and very high carbohydrate amount that raises your blood sugar quickly, and it's so easy to get a large amount of carbohydrates without noticing because these are dried fruits. So when you dry something, how do you dry it? You remove the water content of it. And fruit have a lot of water, which again dilutes the amount of sugar present in them. So if you remove that water, you're left out with a lot of sugar. And so fruit that is dried of all sorts, whether it be peaches or plums that are dried, we should make them prunes, or raisins or cranberries, they will have much higher sugar content than their fresh counterparts. So always go for the fresh one. Now let's move on to the next level of eating fruit, which is basically in the middle. It's not as bad as these options, but it's not as good as just some of the other options. So these fruits are in the middle. They are not as bad as drinking a fruit juice or eating preserved fruit or eating dried fruit, but at the same time they are not good either, and you have to be very careful with them. The absolute worst in terms of sugar content per volume basically are dates, and they are present on the left lower part of the screen, have so much sugar. And the next one would be the bananas. Bananas do have a lot of carbohydrates. Now, this is a little bit controversial because if you look on the internet and you will see that grapes and melons are generally listed as good fruits, and that might be confusing to you. Now, why would they list them as good fruits? I'm saying that you need to be very, very careful with grapes and with melons. So why am I saying that? I'm saying that from the diabetes perspective. People who say that grapes and melons are healthy, they are going by very strict limitations in terms of comparing them to other fruit items by weight. Now you can see what the fallacy is here. Those fruits have a lot of water, whether it be grapes or the watermelon or the cantaloupe and honeydew. They have a lot of water. Now they do have a lot of sugar as well, but they have a lot of water. So it is kind of unfair to compare 100 gram of watermelon to 100 gram of peach, for example, or something like this, because the watermelon will have a lot more water content. So it would appear that it doesn't have as much sugar, as much carbohydrates, but in fact it does, because nobody's going to just eat a small like a quarter of a cup or half a cup of watermelon. People, when people eat watermelon or honeydew, they eat large portions of it because it gives them a false sense of security. Basically, they feel like this is a fruit, so it's supposed to be healthy, but also it's full of water, which is true, so I can eat more of it. Or some people have the misunderstanding it's just water. It's not just water. It has water definitely, but has a lot of sugar as well. So what I'm saying is that nobody's going to stop at 100 grams of watermelon or of grapes, or eat like 5 grapes and then stop. People will usually tend to eat larger amounts of these fruit and snack on them through the day, especially in the summer, which makes them more dangerous. So you have to be very careful with those things. Now, none of these four fruits that I mentioned here need to be avoided altogether. But you have to be real careful with it. If you're going to have, for example, watermelon, you need to have like a small cup of watermelon. And always, what applies to all fruit is to have them with the meal rather than in between the meals. And I'll talk more about this when I come to the best kind of fruit. But those are important principles. You have to be very careful. I would say probably dates, try to avoid them because they are just so much filled with so much sugar. But when it comes to bananas, to grapes and to watermelons, you have to be careful of the portion size that you have. It doesn't have to be a full big banana which has 30 grams of carbohydrates. You can have half a banana. You can have a small cup of grapes or of watermelon, honeydew, but you have to be careful with the amount that you get because they have a lot of sugar content compared to the volume that most people eat of those fruit. What are the best fruits? Well, you see them here in this picture. So on the upper left side, you can see oranges, pears, and apples. Those have a lot of fiber, have a lot of vitamins, have a basically relatively low sugar amount compared to their satiating effect or how much they make you feel full. And under that, you see the picture of plums, nectarines, and peaches. They or apricots as well. They have relatively less carbohydrates and then the bananas and the melons and grapes that we talked about in previous pictures. And they also make you feel full, so it's a very good option for a dessert to have 1 or 2 plums, for example, after dinner meal, or to have an orange with your lunch. So those are good options. But the best fruit by far, the best one from multiple aspects are the berries. And you can see a picture of berries here: blueberries, raspberries, blackberries, strawberries. the idea is that they are very rich in antioxidants, especially blueberries and raspberries, and they have a lot of also fiber. They have relatively small sugar amount. You can make them sweeter by adding perhaps a more kind of delicious meal by adding perhaps some nuts to them, or if you must, you could choose a relatively healthy sweetener such as the stevia. That stevia is the only one I would say is okay to have as a sweetener, and you could add some of that stevia on that mix of blueberries and nuts and mix them and put them in the fridge, and you'll have a very nice dessert that you can enjoy. So those are the best. Now I go back to saying that fruit are the best dessert with the meal. If you want something sweet to enjoy, they are the best in the form of a fresh fruit, but they are not a good snack because you have to set limit on the quantity of the fruit. Remember, fruit is sugar. It's a natural sugar and is definitely much less than what you find in a dessert, but it is still sugar. So you have to be very careful with how much you eat of it, and just having them as snacks doesn't put that limit on the quantity that you eat. So if you keep on eating or snacking through the day on melons or on grapes or even on plums and peaches, or any kind of fruit for that matter, that increases the quantity that you get of it tremendously, and therefore increases the total amount of carbohydrates and sugar that goes into your body. It keeps your sugar high even in between the meals, doesn't let it come down, and it's a common reason we see in diabetes clinics for the blood sugar to rise high through the summer. And especially that a lot of people don't think of fruit as having any problem with diabetes. They think as, oh, fruit is healthy. Well, now you know. And so it's not going to feature on the list of snacks when we get to the healthy snacks or what you can have as a snack. You're not going to see it there. Snacks are another very complicated topic. Lots and lots of misunderstanding and myths involved. And I could dedicate just an hour to just simply talking about snacks and what they are and the ideas behind them, but we don't have an hour for that. Maybe I'll make a separate video, but for now I just want you to remember that you don't have to snack. And I say that because I know a lot of well-meaning dietitians, healthcare professionals, nutritionists. They will tell you, oh, you've got to eat 3 meals and 3 snacks a day. No, you don't. You do not. It's not going to help you. The more food you eat, the more chances of eating you have, the more chances you will have of raising your blood sugar, of introducing calories, of getting carbohydrates. So why would you do that? Now, I'll tell you why a lot of the dietitians would say that. Now, again, they are well-meaning, and that's how they were taught. So, we need to have some, mercy, compassion, understanding of how that error came about. But it is an error, and the error is because they think that the more frequently you eat, the more it raises your metabolism, and therefore the more you're going to be able to process the food that you eat. So for example, they will say, okay, well, if you don't eat, and I've heard it said in that way, which is very confusing to patients, is when somebody counsels, a dietitian, for example, counsels a patient with diabetes, they will tell the patient, well, your problem is that you don't eat, and your solution is that you would eat 6 small meals per day. And the patient will be very surprised and ask, well, how's that? And they say, well, because you don't eat, you don't eat enough, like quantity. They will say you don't eat enough quantity of food, and because you don't eat enough quantity of food, you eat, like, for example, 2 times a day, then your metabolism slows down, and you're just keeping this food, and that you're basically not metabolizing it, and your metabolism is so slow that you're gaining weight and that your blood sugar is running high. Now, there is some truth to that, which is that, when you don't eat, especially if you go past noon without having something to eat, that slows down your metabolism. But there is a limit to how much it slows your metabolism and how much that adds on in terms of blood sugar and in terms of weight. So it cannot override, for example, the quantity of the food that you eat. For example, can you imagine if some place that has starvation, that people don't eat at all, now, do you think that they're going to be obese, or that they're going to gain huge amount of weight? Well, they are, according to that theory, they should be obese because they are not eating at all, right? So they spend like a week without food at all, right? So as a result, you would, according to this theory, their metabolism is so slow that it will add a lot of weight on them, that if you check their weight, you'll find it to be morbidly obese, because their metabolism is like kind of completely dead, so they are just gaining weight. Right? Wrong, of course. And anybody who thinks of it with common sense, they will say, no, I mean, of course, somebody's not eating, they're not going to gain weight. They're going to lose a lot of weight. You'd never see somebody coming out of a starvation or in a starvation area, which is an awful and horrible thing in our civilization, to have something like this happen nowadays. But you never see somebody with that, gaining weight. You always see them losing weight. Why? Well, yes, their body is trying to conserve the energy. That's true. Their body is slowing down their metabolism. That's true. But it never can override the fact that their nutritional, the amount of food that they get per day, is so low. And so the end result is that they're going to lose weight. So one of the principles in human physiology, in the human body, is a compensation can never override the primary insult or the primary event. So the primary, what's the primary event here? The primary event is that you're not getting enough calories, right? So you so your body, in response to not getting enough calories, right, is going to slow down your metabolism in order to conserve the energy and prevent you from dying from starvation. But can it lower your metabolism so much, so bad, that it makes you, like, it overrides the lack of nutrients and make you gain weight? Never. It's not possible. It's an attempt at compensation. It's an attempt at decreasing the harm that happens from starvation, but it's never going to override it to the other side. So obviously, when somebody says to the dietitian that, I'm basically eating 500 calories a day, right? Now, and I'm gaining weight. Now the dietitian is trying to basically empathize with that person, that she's trying to kind of take what they are saying at face value, and she said, well, the only explanation is perhaps you're not eating enough, and because you're not eating enough, then your body is just like building fat. But that's not true, unfortunately. And with all respect to the dietitians and to the patients who tell them that, it's not true. So if somebody ate 500 calories every day for a prolonged period of time, they will lose weight, unless, of course, they have like some pathological cases of fluid retention, or some severe form of hypothyroidism, or some other disease that's affecting them. But a normal person that doesn't have such a severe metabolic disease, right, if they cut back their calories to 500 calories a day, or severely restrict their calories for a long period of time. It's not like a day or two, but like for a long period of time, for several weeks on end, if they consistently ate 500 calories per day, they will absolutely lose weight. So if they are under the impression that they are only eating 500 calories a day and they've been doing that for 2 months or 3 months, and they are gaining weight, not losing weight, there are two possible solutions. One is that they are not consistently eating 500 calories a day, okay? That some days they are eating much more than that, and that those days kind of undo the benefit from the days where they did eat 500 calories a day. But number two is that they may have a disease that causes them to retain a lot of fluid, or to have a very, very slow metabolism that even with the 500 calories a day, their weight is kind of stable or not going down as much. Those are the two options, but the solution is never that they need to eat more calories to kind of lose weight. That doesn't make any sense, and I hope that my explanation makes sense to you. So I had to go into that because of the idea that somebody needs to eat 6 times a day. You do not need to eat 6 times a day. What is, though, a good time span between meals? Okay, a good time span between meals should be not more than perhaps 5 hours. Okay, but not less than not less than 4 hours, because if you are eating like every 2 hours or so, that actually just like it causes what we call stacking on of carbohydrates. So you're adding more carbohydrates as you're eating, and that helps stimulate your pancreas to produce more insulin. And it just makes you in a vicious cycle where you have a high insulin state that is causing more hunger and causing more weight gain. So eating every 2 hours or every hour is not a good thing, but at the same time, waiting more than 5 hours in between meals is also not a good thing. Not just because of the misconception of how much it affects or lowers your metabolism, but more importantly, because it just makes you hungry at the next meal. And one big example of that is somebody who works, right? So they work, maybe their work is a lot of stress, a lot of perhaps physical labor. They have their meal or breakfast meal in the morning, but then they don't get to eat lunch. Maybe they don't get to eat anything until they come home at 7 p.m. or 6 p.m. from work. Now, at that time, they are extremely ravenously hungry. They will eat the wrong options, and they will eat a lot of the wrong options. So they will eat a lot starch, a lot more carbohydrates than they should. They will eat dessert after the meal. They may snack before they go to bed. And all of that happens because they did not get a good lunch. They did not get anything also between lunch and dinner. So ideally, if breakfast is, let's say, 8 or 9 o'clock in the morning, you don't really need to snack between breakfast and lunch, because if lunch is at noon, that's just like 3 or 4 hours. You don't really need to eat in between breakfast and lunch. You already had breakfast, should be good and satisfying breakfast. We'll talk more about breakfast in the next slides, but then you're going to eat lunch at noon, right? So that's 4 hours perhaps. That's fine. You can wait 4 hours. It's not going to cause any harm if you don't eat anything between breakfast and lunch. It will cause harm if you do eat a lot of snacks and every 2 hours or so eat a snack. That's not good for you. So you want to eat breakfast, you want to eat lunch, and then if your lunch is noon to 1 p.m. or something like this, and you're not going to have dinner until you come home and it's like maybe 7 p.m. you had a stressful day at work, trust me, I know, and you had like perhaps somebody at work giving you a hard time, and you're just upset, had a tough day and then come back, haven't eaten for 7 hours, you're not going to be practically able to implement any of those principles we talked about in terms of carbohydrates and limiting your carbs, eating more vegetables. You're just going to eat anything in front of you, something that will also make you feel more comfortable. Now, I understand. I'm not criticizing or anything. I empathize fully with you. But what I'm saying is a good option in that case is to have like a healthy snack at in the middle between lunch and dinner meal. And here are some of the healthy low carb snacks that will make you stay full, but at the same time that will not raise your blood sugar or cause a problem. So what are they? So you can see here basically vegetable group, and you're always going to see the vegetable group come in any healthy suggestion because there is nothing better than the non-starchy vegetables. You can also have nuts. You can have some cheese. You can have some protein. The protein group will have like tuna or eggs, something like this. Now, some of these things are just not practical to have at work, right? So what can you do if you're just trying to have something healthy at work? You don't want to go to a vending machine and eat some of the desserts that are present there and so on. That's really a bad option. So what should you have? Well, here are a couple of suggestions. So you could have, for example, those cheese, low fat cheese bars, such as the Sargento one or the store brand from Walmart or any grocery store that you could have 2 or 3 of them. They are good. They have high protein content and they don't have carbohydrates, so they are very low carb. They're going to be satisfying. You can also have something that perhaps some vegetables like baby carrots that you can have together with that. You can have some nuts, non-salty nuts. They come in packs. Remember what we talked about, which is nuts pack a lot of calories in them because they have a lot of fat in them, healthy fat, but still fat. So they have a lot of calories in them. So how do you prevent yourself from eating the whole box of nuts, which will it will not raise your blood sugar much, but it will actually affect your weight. It will make you gain weight if you eat, because that's a lot of fat. So what can you do to limit that amount? They actually sell these nuts in packs, and you'll see 100-calorie pack of nuts. Or you can see sometimes if you want more, 250 calories. Packs of mixed nuts or so that would be very filling and satisfying. Now you have to remember, avoid fruit, and especially avoid dried fruit. Trail mix is not a good snack. Cookies, crackers are not good snacks. Fruit is not a good snack. So you have to remember these things because those are very common mistakes that people fall into. Please share your comments in the comments section, and please let me know if you learned something new today about any of the topics we discussed, about fruit, about dessert, snacks. Was there something that you realized that you didn't know before? Please also share those videos with anybody who might be interested, and stay healthy. I'll see you next time.